I want to thank everyone for joining us on this very busy news day. We're pleased to be here. I want to introduce the CEOs who are on the call, and then I'll lay out the logistics for the meeting. So joining us today is Dan Winkelman, President and CEO of the Yukon-Kuskokwim Health Corporation, Preston Simmons, CEO of Providence St. Joseph Health, Alaska, Tim Gilbert, President and CEO of Manioc Association, Shelley Ebenal, CEO of Foundation Health Partners Fairbanks, Dr. Bob Onders, CEO, Alaska Native Medical Center, Rick Davis, CEO, Central Peninsula Hospital, and then myself, Jared Kosin, President and CEO of the Alaska State Hospital and Nursing Home Association. So I will start with very brief opening remarks, and then we're going to hear from Dan Winkelman and Preston Simmons. Following their remarks, we'll be happy to answer any questions. During the questions, we will call on each of you one at a time. If you have additional questions following your turn, please use the chat feature to let us know, and we'll do our best to provide another opportunity for you to ask your question. So to kick this off, I do want to thank our state partners and recognize that we are all under enormous pressure right now. With less than 10 days to go to the expiration of the state's public health disaster emergency declaration, we want you to hear firsthand from Alaska's hospital leaders on the importance of maintaining the declaration and the seriousness of COVID-19 at this very moment in time. We are setting new records for hospitalizations on a weekly, if not daily basis. In the first week of October, we averaged 31 COVID hospitalizations per day. In the last week of October, the daily average jumped by 113% to 66 COVID hospitalizations per day. Just last week, we started with daily hospitalizations in the 50s and ended in the 80s. To demonstrate how fast hospitalizations are accelerating, I want to share something with you. I prepared these remarks that I'm reading to you right now on late Monday afternoon, and they were essentially stale by Thursday. This is because we set a new record yesterday with over 95 COVID hospitalizations and over 30 ICU stays. Close to half of these patients are being cared for in hospitals outside of Anchorage. Let me be clear today, at this rate, Alaska's hospitals are headed for crisis. If there is no emergency declaration in place after November 15th, our ability to provide healthcare will be utterly compromised. There will be no authority to operate alternate care sites, no authority to administer home monitoring programs for COVID patients, no authority to render telehealth without provider and patient constraints, no authority to systematically expedite licensure of critical health personnel. We have been fully engaged and transparent with the state and administration on this issue and are hopeful that they will address this soon. Time is of the essence. I will now turn it over to Dan Winkelman, President and CEO of Yukon-Kuskokwim Health Corporation, and then Preston Simmons, CEO of Providence St. Joseph Health, Alaska, to provide real-life examples of how important the declaration is and the stress of COVID on operations. Dan?
Good morning. Healthcare is one of the most heavily regulated industries in the world. If the state of Alaska's emergency declaration goes away, Alaska, like all other states that received a Section 1135 waiver issued by the Department of Health and Human Services and CMS in a letter to Commissioner Crum on April 2nd, 2020 says, quote, "The emergency period will terminate and Section 1135 waivers will no longer be available upon termination of the public health emergency, including any extensions," end quote. This was a blanket waiver of many of the federal Medicaid and Medicare requirements. One such requirement was the Medicaid requirement for in-person visits that would kick in upon the end of the declaration. Therefore, telehealth would largely be over. Telehealth was how Alaska's rural hospitals like YKHC have stayed in business during this spring's lockdown, and how we are still paying the bills as our first wave of COVID begins to hit us very hard here in rural Alaska. This is because Alaska's rural hospitals largely provide outpatient services, unlike our urban counterparts. Our rates of new cases here in the city of Bethel for a 14-day rolling average is 156 per 100,000 people. In Chivac, it's 1,793. In Gwinhawk, it's 492. In Tooksuk Bay, it's 971 per 100,000. Those rates are a little different than how the CDC in the state of Alaska calculates rates, because they calculate them on a 7-day average. That computation, if we were to do it that way, skews our averages because of delays in receiving timely lab results to our remote locations. So instead, we use a 14-day rolling average because of our very small populations. These numbers can vary widely over short periods of time. For comparison purposes, the state considers greater than 20 to be in the red, and Bethel, again, is currently at 156 per 100,000. With rates this high, if we do not break the cycle of transmission, we have modeling that indicates from Dr. Tom Hennessy at the University of Alaska Anchorage that we will overrun our healthcare capacity before the end of November. As we know, increased hospitalizations and deaths follow every wave of COVID, and there is no reason to think that we are any different. That's why we recommended last week that 14 villages go into lockdown, for a total of 18 villages in lockdown in the YK Delta for a minimum of 2 weeks. It is our hope with these extreme actions that we will be able to significantly flatten the curve. If we're able to flatten the curve according to Dr. Hennessy's modeling, we'll be able to extend our wave into mid-January. I hold up the village of Ninapachuk as a shining example of what can happen. We had widespread community transmission there not too long ago, about a month or so. And we implemented strong public health actions with the village, and we're able to break the cycle of transmission there. When done with strong leadership and a willing community, we can stop COVID in its tracks. Thank you.
Thank you, Dan. Preston?
Good morning. First off, as Providence, we want to thank the State of Alaska partners for the incredible work that has been done to date. Now is definitely not the time to create uncertainty in how we've been able to collectively work together to battle this pandemic. The federal waivers and state declaration provide hospitals and the healthcare community with the necessary and invaluable tools to deliver care and protect the public health. As we enter these winter months, it is absolutely critical that hospitals and the provider community have the stability and the assurance these flexibilities provide to best respond to the growing need. The waivers and declaration that will expire without an extension allow us to be creative in how and where we provide care. Without this flexibility, hospitals and providers are concerned that we will lose the ability to continue providing programs such as our in-home monitoring program for COVID-19 patients. This has been a great example of how Providence has been able to partner with multiple hospitals throughout the state during the pandemic to augment inpatient capacity in the community served. In-home monitoring helps to avoid many hospital admissions with this care at home program. COVID-19 patients in Anchorage, Fairbanks, Seward, Valdez, and Kodiak have been monitored at home. This crucial service is also set to expand to the Mat-Su Valley, which has seen a rapid increase at home recently in cases. More than 335 Alaskans have been served through this program to date. We've seen improved health outcomes while protecting critical hospital beds for more serious cases. Without the declaration, the home monitoring program will have to stop admitting patients effective November 15th. Another example is offsite testing and alternate care sites. Offsite testing sites have proven critically important to limiting the spread of COVID-19 in Alaska. Thanks to this public-private partnership, more than 43,000 tests have been performed at the Anchorage's Lake Otis testing site alone. This has allowed Alaskans to receive test results they need to keep themselves and our community safe. The alternative care site at the Alaska Airlines Center in Anchorage is another example. The site is designed to provide additional hospital capacity for COVID critical patients, assuming that staffing resources are able to be generated. Without the declaration, we are concerned about our legal ability to partner in these types of critical programs. I also want to touch a moment on the impact of COVID on our operations here in Anchorage. As the state's largest hospital, Providence Alaska Medical Center serves all of Alaska, especially those cases that are most severe and require the highest level of care. The high rate of community spread of COVID-19 is more acutely impacting our main Anchorage hospital operations as of late, not only with the increased number of COVID positive and ICU patients, but also by our own staff that are exposed to the virus outside of work. We have been running approximately 15 to 20 COVID positive census over the last several months. In the last week, we are now routinely running over 30. In terms of staffing being out to the community spread, we have been running about 30-40 range a few months back, and now we're seeing as many of 80 to 100 staff out daily due to community exposure. When physicians, nurses, and other healthcare workers test positive after community exposure, they are not available to care for patients and have to go into quarantine themselves. Staff availability is always a concern in event of a surge, both through increased hospital census and the impact on staff and their families due to that community exposure. Also, a lack of childcare and school access impact our staff's ability to work, just like it does to many of you in our community. Our ability to secure temporary staff to backfill is also limited with increased need for nurses across the entire United States during the pandemic surge that is occurring almost everywhere throughout the US. Because of the nationwide surge, we have very limited ability to access the additional external staffing that we typically rely on this time of year when flu also starts to circulate and all our censuses are high. The bottom line is we need to extend the emergency declaration so that we can continue the licensing, telehealth, and other flexibilities needed to care for our fellow Alaskans the best we can under the current circumstances. And I'd be remiss if I didn't mention that we need to pull together to get through winter and tamp down this surge by wearing our masks, hand washing, and keeping our contacts appropriate. That's the best way we can sustain our health capacity and best support our state economy. It's easy to do and clinically effective. On the economy, I refer you to a great article in yesterday's ADN entitled, "Does Wearing a Mask Help the Economy?" Professor Berry at the University of Alaska has some compelling arguments that say yes. On behalf of Providence, thanks for your support with our critical ask.
Thank you, Preston. Thank you, Dan. So I just want to emphasize one thing, and then we'll open up for questions. This is about operational capability for us. This is not politics. Having the declaration in place is critical to our ability to function. We need that, and we need it now. And the second thing I want to emphasize, I've been with ASHNHA now for 1 year, and I can tell you, to do something like this is unprecedented for us. To ask 6 CEOs to stop what they're doing, to address the public directly is something that we do not do lightly. People often ask, well, when will the alarm bells be going off? When are you guys worried? I think this shows where we all stand. Where we are with the numbers today is not acceptable, and we will not make it through this unless we change our actions. So I want to emphasize that right now and up front. Let's open this up for questions. Questions will go to the CEOs. I'll call on each reporter. This is my first time doing it, so if I miss you, by all means, speak up. Let's start with Sean McGuire from KTUU, and you can pick a CEO or ask a question, and we'll let whoever wants to chime in, chime in.
Okay, thanks very much. My question is, beyond the disaster declaration, what do you feel that you have received enough support from the state, and what sort of other support do you feel you need? And I'd love to hear from each of the CEOs if that's possible.
Great. Dan, do you want to start and then I'll work down the line?
Well, I think we've actually received a lot of support from the state of Alaska, and we really appreciate that. We were having difficulties with enough personal protective equipment here since really the pandemic started, and as we've seen that increase with our COVID wave here in the region in the last month, we've been running short on gloves. I worked with the Alaska's Unified Command a couple weeks ago, and Jared and others to have some really productive meetings where we were able to get additional PPE from Alaska's Unified Command, as well as the Indian Health Service. So we've worked on those issues together. We're going to get through this together. We're married, essentially, if you will, and it's going to be a long winter. So we're going to be looking forward to working more with the state of Alaska. I think where the state can obviously support smaller communities throughout the state of Alaska is with universal masking. Universal masking has been proven to reduce transmission of COVID when people are in public and they're not able to socially distance. That is where universal masking can greatly help. Most of the states in the lower 48 have laws on universal masking, and that will help us reduce COVID transmission this winter.
Thank you, Dan. Rick Davis from Central Peninsula Hospital. You want to go next?
Sure, yeah. I mean, I echo Dan's comments. The state's been very helpful. The whole incident command structure that starts at the state level and comes down through our borough and our hospital has really given us a good source of needed PPE. And without the disaster declaration, I'm worried about losing that prioritization of the PPE. We're, yesterday or the day before, we actually were out of the duckbill N95 mask, which is, we had other kinds of N95s, but we didn't have the duckbill, so we had to go fit test a whole bunch of new employees. Some of the other implications of, like Preston talked, we have today 37 staff members out on quarantine, and I think we have 9 positive staff members at home on quarantine. And all those positions have to be backfilled. It's hard to find temporary traveler nurses and staff because all hospitals are in the same boat. So losing the declaration would probably impact our access to FEMA funds and other grant funds that help pay some of those additional COVID-related expenses. So we appreciate what the state's done so far, and hopefully we can continue this framework until we see a downward turn in this pandemic.
Thanks, Rick. Tim Gilbert from Manila, would you like to make some comments?
Sure, thanks. Just briefly, Manilic Association is hubbed in Kotzebue, as you all know, and off the road system. We've appreciated our relationship with the state. Our local borough and city leadership has had a lot of communication with the governor's office and the commissioner's office. Because we're off the road system and testing has been critical to our COVID response, I guess I would say the area that we wish we could have got some more assistance or more attention was testing. That was an early issue and has remained kind of an issue for us as we do airport testing and testing at our hospital, our critical access hospital, and in our villages. So I think if I was to talk to one area where we wish we would have had increased assistance, it probably would be testing and testing assistance from the state. But other than that, we've had a really productive relationship with the state. Thanks.
Thanks, Tim. I appreciate that. Preston, would you like to go?
Sure. I would just echo the comments that the collaboration with the state, I think, has actually been a model for the rest of the country. People have come together, worked well, very transparent. hospitals, clinicians, the state of Alaska, Governor Dunleavy's office, Adam Crum, and Zink. Everybody's just worked tirelessly to work together. And I think we've had great benefit. It's been challenging for everyone, but I think the communication has been open and everybody has been focused on caring for Alaskans and done whatever's been asked of them. So I'd say it's been very, very good.
Thanks, Preston. Bob Onders from ANMC, you want to comment?
Sure, I can echo everyone else's comments. The communications with the governor's office, the commissioner's office, state of Alaska, EOC has been great. I think the collaboration on many parts has been worked well, and I think the state has been receptive to our inputs and our thoughts. And sometimes it's a lot easier to identify what hasn't been done than what's been done, because the majority has been exceptional, the relationship. But to echo what Dan is saying, the situation we're in right now was very predictable in August when we saw the cases rising. And the more and more we know about COVID, it's relatively easy to manage and damp down the spread, but we have to do it together. Patchwork legal frameworks across the state are not going to stop the spread. So we need, and I don't like the word mandates because there's a national or a kind of pushback against that. We just need basic public health regulations that are consistent, bare minimum across the state that would protect both the road system and the rural communities. I had conversations with Dr. Ellen Hodges, who's the chief medical officer with Dan Winkelman at YKHC, knowing that as the cases rose in the road system, it was coming to rural Alaska. And it's unfortunate that we didn't do something to stop that from occurring, because what we will see is what we're seeing now is the elevation and escalation of hospitalized patients, ICU patients, and deaths. That is coming, and it's coming here in the next few weeks to more. You can look at the predictive models and the numbers, and it's just in some ways unfortunate we didn't stop it earlier.
Appreciate that, Bob. Thank you. And then our last CEO on the call is Shelley Ebenal from Fairbanks. Shelley, would you care to comment?
Thanks, Jared. Yeah, we have had a great working relationship with the state, Commissioner Crum, Dr. Zink, Heidi from Unified Command. They've been amazing and wonderful to work with us. You know, we ended up in a weird spot where we were too small to be big and too big to be small, as you guys have probably all heard me say 1,000 times. And the state really did go to bat for us and really did help us out. So we were extremely grateful for everything that they have done for us. But as of today, we're having a snowstorm. And like Preston, we have so much staff out that we have the night shift staying in order to staff our hospital. Really where we are struggling is with the number of, not the number of COVID patients in the hospital, but the number of staff that can't come to work either because they have COVID or they're in isolation or they don't have childcare, all of those things. And so I think as a state, we are still really struggling, and I don't know that we've seen the worst of it yet. So the mandates are really important, and I hope that the governor sees his way to re-upping them. Thank you.
Thank you, Shelley. Zaz Hollander or James Brooks from ADN. What question would you guys like to ask?
Oh, this is Zaz, and if James has another question, that would be great. I'm wondering, CEOs, if you had to prioritize the elements that you want to see in the declaration, what would those be? What are the most important aspects for you?
Anyone's welcome to jump at that.
I think kind of what Jared mentioned at the beginning of the dialogue was around the telehealth and the licensure flexibilities. That gives us the ability to use staff, sites of service, and taking care of patients in different ways than traditionally we can't with those legal provisions. So I'd say those are extremely important. The other items are from a clinical standpoint, which Dr. Onders mentioned. It's important that we encourage to the greatest degree possible those simple things that we know work around mask wearing. And this is, it really is a math equation if you think about it. As the community spread goes up, there's a certain percentage of patients that have underlying conditions in the community that convert into hospital admissions. A certain percentage of those go into ICU admissions, and a certain percentage of those have mortality rates. And as it goes up, you can predict this very accurately. And what happens is right now it's spreading in the 20 to 40 age groups. And what happens after that, and we've seen this in the lower 48, then it starts going into the sicker populations, those at higher risk, those that are over 60 years of age, and those have a much higher admission rate. And that's where we're going to get overrun. And then also with that community spread, just the percentage of our staff that are exposed when they go to grocery stores or schools or any of those type of things. So we really need to follow those basic public health measures that we know work. They're easy, it's courteous to each other, it doesn't require necessary mandates. It just requires compliance throughout the state to be able to put those in effect, and those will tamp down the spread. But we got to jump on that immediately. The declaration is paramount in terms of giving those other flexibilities in terms of how to care for patients once they get COVID.
And I think I would highlight too what Dan Winkelman outlined in his initial comments, and he did it very well, pointing out to the federal flexibilities. The big thing for us, Oz, is a declaration in place in our minds secures all of the blanket waivers from the federal government. So for us, prioritization for telehealth and staffing is obviously clear from the answers, but even beyond that, the idea that we would lose even a single flexibility, we don't even want to prioritize it. We want to make sure everything's in place. Does anyone else want to jump on that or add anything else?
Yeah, go ahead.
Oh, one additional comment. I mean, the practical reality is we have an alternate care site open at ANMC. We've converted one of our housing units. We have 10 patients in there now. And last week, from Wednesday to Thursday, our number of COVID inpatients doubled, and we had to shift people down in order to accommodate and move people around in the hospital. And we're going to have to continue to expand the alternate care site to accommodate that. And I wouldn't be surprised, like Preston mentioned, whether we have to move into the Alaska Airlines alternate care site as well in Anchorage. So without the emergency declaration, we would have to find places for additional 10 patients at ANMC. And we run between 500 and 800 people a day through our testing site. It's those little operational components that are enabled by these emergency room declarations that we need to have in place.
The other risk, I think, is to communities throughout the state, especially our rural communities, in terms of the CARES Act funding that has come in that allows them to do some of these alternative sites or tests or getting other staff in or just making some of the changes that are needed. If we don't have an emergency declaration in this state, then those CARES Act funds, which are based on being provided to the states because they have an emergency in place, we have a potential of losing those as well. And that goes to the municipalities around the state. It goes to the rural communities. It goes to healthcare providers. It shores up a lot of infrastructure throughout our entire state of Alaska that's desperately needed as we continue to battle this.
The other critical issue that's related to that is, the CARES Act, it ends at the end of this year. And I was on a conference call with Senator Murkowski yesterday with rural hospitals, and I was advocating for her and her colleagues to extend that into next year. COVID's not going away anytime soon. We're going to be needing those funds for additional staff and be paying for TDYs throughout all of next year, most likely. So it's really critical that we get the CARES Act funds extended through next year beyond the end of this year.
Anyone else want to add to that? That was very well covered. All right. James Brooks from ADN, do you want to ask a question or should we continue to the other reporters?
Jared, if I could yield my question to Zaz, that would be ideal.
Okay. Zaz, I'm going to put you at the back of the line and we'll come back and get you at the end. Is that all right?
That's fine. Thanks, Jared.
Yep. All right. Brian from the Peninsula Clarion.
Hey, everybody. Thanks for being here. Can you guys hear me?
Yes, go ahead.
Okay. My question is directed mainly at Rick Davis. I just want to get a sense of the local situation here on the peninsula. You talked about staffing issues already at CPH. Can you talk a little bit about whether or not this this critical mass of hospitalizations has reached CPH at this point, and what you guys are looking at in terms of ICU beds, things like that?
Yeah, hi, Brian. Yeah, we are okay today. We've been averaging 5 to 7 inpatients over the past several days, which is a lot. That's kind of a record number of cases for us. I think we're down to 5 today, but we had 2 in the ICU and 5 on the med-surg floor yesterday, and they're turning over pretty quickly. You know, we discharged 2, get 2 more in. So we're on the verge of, you know, if that trend continues, we're going to start pushing up against capacity. And we do have an alternative care site that we put together here within the hospital in our old obstetrical unit, which is has been empty. And one of the concerns I have if we lose the declaration is that our you know, that puts us over our licensed bed capacity, and I'm worried that we could be in violations of our license by utilizing those alternative care beds if that licensing waiver were to go away. So we're doing okay right now, Brian, but we're, you know, if the trend continues, we'll be starting to struggle a little bit more.
Thanks, Rick.
Okay. I'm going to go to Peter from the Juneau Empire.
Thank you. I was hoping you could expand a little bit more beyond the funding picture, because, you know, the emergency declaration will extend, but the CARES Act funding ends at the end of the year. So what's the ability for hospitals to fund themselves beyond that? Thank you.
I guess I will jump in on that and then anyone can follow. The funding piece, to Dan Winkelman's point earlier, the CARES Act ends on December 31st, which means all the funding that's been put out to date is supposed to be used against this current year expenses. The issue we have in Alaska is the funding has been very helpful from the federal government, especially the rural distribution, but even with all that funding out there, right now we're experiencing our big wave, and uncertainty is at its greatest point right now. We know this is going to spill into next year. At least we think it's going to. And with all the staffing issues we're experiencing now, and with the actions we're going to start probably taking internally to brace for pressure, you're going to see our operations significantly change, and we're going to have a lot of exposure on expenses and on the revenue side. And if that happens, that's when we want to see the CARES Act funding flow in. Right now, that's not possible because it cuts off at the end of the year. So our big piece is 2 things. Number one, we want to see the CARES Act nationally extended in the next year so that there may be more funding opportunities, so that if we start experiencing the pinch now, we're going to get through any solvency problems. But the second issue is that we really want to make sure, I guess I'm going to stop there. That's the big thing, is we really want this to extend forward. But the second piece I guess I would add is if we don't have an emergency declaration in place, all of this federal funding that comes in is formula based. And we know this because we've seen the different tranches flow in and they've taken into different variables. If Alaska is the only state in the union without an emergency declaration on its books, we're willing to bet that we are going to be either excluded from those formulas or we're going to rank dead last in all of them, and we're going to miss out on future funding opportunities. So this is a real issue about funding. Does anyone want to add to that?
I guess, Jared, this is Rick. I might just briefly add, you know, another source of funding is the FEMA funding that is made available to the hospitals. And I don't believe that much of that has actually been accessed yet, because it has to do, it's a funding source that goes after all the other funding sources have been exhausted. And so, you know, to lose our declaration right now and lose the ability to capture those FEMA funds would be pretty devastating to everybody, I think.
Okay. Preston, are you about to say something, or should I move to the next? Okay.
No, we're good.
All right, next reporter is Dan Ross. Dan, you messaged me a question. I'm gonna go ahead and let you decide what you want to ask. If it's that, can you repeat it for the group? And if you change it, by all means do so now.
Hi, this is Robin from KUAC. Dan had to drop off to prepare a newscast, but he put his question in the chat about the message, unified message you all seem to be doing about asking for an emergency declaration. I'm wondering if Commissioner Crum will be making a statement here about the declaration extension and how your message, unified message, is different from the governor's office.
Commissioner Crum, I think, is here to watch. He's not here to attend, so I don't want to put him on the spot. He's also welcome to come on, but I'm going to assume he's not going to, because that'd be unfair of us. I mean, for us, I go back, this is not a political issue for us. There's no political calculations. I'm not suggesting that's happening outside of us, but it's purely operational. I mean, we need this. So we've been very clear from the beginning on why this is important. We've emphasized it. We've communicated with the administration. We have had good conversations with them, and now we're waiting to see what's going to happen. And I think for all of us, as you can tell, the stress all the facilities are under and the numbers we're highlighting today, this is just an uncertainty we do not need in our lives right now. We need to remove it so we can all continue forward and figure out how to address this crisis. So that might be the reason why you kind of hear different messages, but for us, this is purely operational at this point. Does anyone want to add to that? Okay, I'm going to go to Andrew Kitcheman. Andrew, the floor is yours. Okay, I think Andrew dropped off.
Can you hear me?
Oh, there you go, Andrew.
Can you hear me?
Yep.
Thank you, Jared. So in response to the question about the state, a couple of the CEOs referred to either regulations or, well, it's a little hard to characterize it, but what I was going to say is Mr. Onders said that we just need basic public health regulations that are consistent. And Mr. Simmons said it doesn't require mandates, but it does require compliance. I'm interested in what specifically you all are looking for regarding masks. If it isn't a mandate, like what kind of language would you look for from the state that you haven't, that is not in place right now?
Does anyone want to jump at that? Okay, I will gladly take it. Dr. Onders, do you want to?
Well, or you can as well, or if you want to add. I think what has been shown in other states, and there's good articles in the Morbidity Mortality Weekly Report for Arizona, which shows when public health measures are in place that the cases go down, or in Kansas, a public masking requirement decreased COVID cases by 50%. So I think that the knowledge is out there that wearing the requirement to wear masks in public and the compliance with that regulation decreases COVID cases. So, and a patchwork doesn't work because this disease is too contagious. And Alaska's in a very unique position in that we don't have necessarily open borders where it's easily mixing of large portions of the population like we saw in the summer. So even I think now the ability to have mitigation measures could have a larger impact on the case counts.
And ultimately, just to add, we know that masks work, but unfortunately they become politicized. And so the thing is, whether you have a mandate or not, it really is, we need the citizens of Alaska our fellow Alaskans to wear their masks because we know it works. And it ultimately boils down to that. And we need uniform compliance with that across the state. And so the more encouragement we can have by leaders throughout the state, setting examples in all the communities throughout, the better off we're going to be. And we're going into the winter timeframe when people are sequestered at home just because of the weather and those type of things. And so it's the smart thing to do. And you don't want to give it to your friends or your family or spread it at your schools or so forth. And it's bad for our economy too. You know, I pointed out that article, but the thing that we can do is by keeping the spread down, it doesn't require us to shut down businesses and those type of things. If you wear your mask, the spread is so limited, it works really, really well. And there's tons of science out there around that. And we just got to get over the politics and wear the masks.
Yeah, and to that point,
Yeah, if I could add one.
Yeah, go ahead, Rick. Absolutely.
Yeah, well, and so just kind of to carry that out, I have heard it mentioned up in the state level about, well, that should be a local decision because Anchorage and Bethel are not the same. But at the local level, the message that I hear from time to time, different areas as well, we don't have health powers, so we can't declare a mask mandate locally. That has to come from the state. So back to the politics of the whole thing, it's kind of that hot potato that gets tossed back and forth. And total, you know, Kenai Peninsula is now the third fastest growing COVID positive area behind Anchorage and Western Alaska. And it would be nice if there was some, besides just us harping on people to wear their mask, if there was a kind of some help from the government level to push that. You can't argue that they don't work because they do.
Any other CEOs want to comment on that?
This is Tim Gilbert from Manilik. I guess from a rural perspective, you know, it would be nice to have the consistency across the state. We have our patients and community members often get tangled up in our local mandates, city and borough, and sometimes messages from our hospital. But because we're rural and we have a lot of back and forth, a lot of people traveling to Anchorage, whether it's personal or medical or whatever, and we have, if we had a strong mask policy here and people were complying, and yet they go to an urban area and there's doesn't seem to be the sense of urgency to wear a mask, it sends definitely the wrong message, but it, more importantly, it puts more people at risk. So I think consistency between rural and urban in terms of just the fundamental policy of a mask seems critical to me.
Yeah, Andrew, I think it's pretty clear. You can tell if someone asked us if we support a universal mask mandate, the answer is yes. All right, the last question, or not necessarily the last question, I know we're getting close to the end of our time. Zaz, I was going to start, or no, I'm going to go to RB Smith, and then we'll go to Zaz, and then if anyone else has follow-ups, we'll see if we can do them and conclude. So RB
Hi.
Smith, would you like to ask your question?
Yeah, thank you. So I'm with the Nome Nugget in Nome, and our city is debating whether to extend its own emergency order, which would require, among other things, a 7-day quarantine for incoming travelers. And I just wanted to ask at the state level what you saw as the role of local emergency orders and specifically sort of intra-Alaska travel restrictions. And if you think that a statewide order would kind of blanket cover all of that, or if local communities should be enforcing their own policies as well.
Any CEOs want to jump at that?
Hi, this is Dan Winkelman in Bethel. You know, what we need is a statewide universal mask mandate. So, you know, the political calculus of this decision is really unfortunate, but, why we're having this session with you all today is because we need these public health strategies to be implemented on a statewide basis. We need them now. And, the earthquake has happened essentially out here in the YK Delta. The tsunami is on its way. It's been cited. And just a matter of whether it's going to be a 5-footer or a 50-footer at this point. And if we implement public health strategies now that can break the cycle of transmission, we will be able to reduce the size of that wave. And the unfortunate part of this is none of us here want to get into having full hospitals 2 months from now around Christmas time and rationing care. We do not want to get into that position, and that's the way we're going. And so if political leaders can advocate for universal masking across the state, the better we'll all be this winter. Otherwise, we'll be addressing the same issue 2 months from now or a month and a half from now, and it will be too late, essentially, because there is a lag of several weeks once this process of community transmission starts in various communities all throughout Alaska. And if we get to that point and universal masking is then implemented, we are in trouble for the next month or at least a month, because at that point it will be too late, and we will be seeing lots of bad outcomes.
And I couldn't agree more with than what Dan has stated. It's fish or cut bait now. It's all a timing issue. We can see in the statistics the increases, and if we don't tamp it down, one thing you should know is that Alaska has the lowest or some of the lowest bed to population ratios in the country. Okay, so we have that issue, and then we have the access to staffing right now. So we have a fixed constraint, and you can't put more into a basically a fixed a bottle size, and it's going to overflow, and that's exactly what will happen. We'll end up in places like you've seen in the lower 48, what others have gone through in terms of New York or some of those type of things. And we have a high likelihood, if we don't pay attention, get our declaration in place, mask, do the things we need to, we're going to be in big trouble. And I don't think we can be that, any more straightforward than that.
Just a quick.
And this is not hyperbole.
Just a quick comment on the universal masking. We're in the same position Rick Davis is, in that our borough doesn't have health powers, and our community leaders have refused to even make statements about masking. So a universal masking coming from the state would be extremely helpful in Fairbanks.
Thank you for that, Shelley. Okay, I said I'd circle back to Zaz since James deferred his question to you. So Zaz, do you want to take an opportunity to ask a question?
Sure, I'll ask a quick question. So in terms of the emergency declaration and the renewal, the governor, there are different ways that could happen. One of them is the governor could extend the declaration. The other that seems to be kind of the rising likelihood is that he could call the legislature into special session. Is there a preference among you all? It certainly seems that the governor kind of making a de facto decision would be the simplest way to go about this. Are there risks with the special session?
From a practical standpoint, the cleanest way is if the governor and the legislature work through it together, from the concept that what is in place today would continue to be in place tomorrow. But from a practical standpoint, I think it's safe to say we want action now, and we'll take whatever can happen now. So if that means the governor puts in a new declaration and secures this and removes the uncertainty, I think that'd be very welcome by all of us. This is not an ideal situation for anybody. So I think that's where I would leave it. Does anyone else have any comments on that?
I would concur. Time is of the essence. The 15th is here, soon.
Yeah. So yeah, I suppose with the time being the risk, the governor acting now would probably be the preferred route in terms of things you can't control. All right, I think we can do one more question. I'll just do it randomly. Does anyone speak up now? You can ask a follow-up question and then we'll conclude the press conference here.
I have one.
All right,
This is
Andrew,
Andrew
goes to you.
Following up on Zaza's question, if the governor were to take action, disaster declarations, can you hear me?
Yeah, go ahead.
Sorry. Disaster declarations expire after 30 days. If he was to issue it now, I guess theoretically he could issue additional declarations in mid-December and in mid-January before the legislature comes back in mid to late January. Do you have any thoughts on whether that would cause any uncertainty?
Yeah, I mean, I think for us, we don't even want to be in this position of working through it and analyzing and trying to understand what can and what can't happen. We want it resolved, period. So right now, the deadline we're all watching and are concerned about is November 15th. And if that means the governor can act unilaterally, and that's the fastest path to achieve this, you know, we're happy with that. But then you are correct, Andrew. I mean, it brings up that 30-day question. In an ideal world, we will all work together and get this resolved and permanently extended forward for a long period of time. But I think as we've seen with politics and kind of the variables out in the world, it's probably not necessarily achievable. So at this point, we want action now. We're worried about November 15th. And then beyond that, we're gonna, you know, hopefully get everyone on board and understand the situation and how dire it is and get this permanently fixed. Do any of the CEOs want to comment on that?
Nothing to add. I think that was well stated.
Thanks. All right. I know there's at least another press conference maybe at noon in Anchorage that I'm sure you're all going to be covering, so I don't want to hold you any longer. I think this is going to conclude our event for today. A major thank you to all the CEOs for you to take time out of your calendars when we're dealing with what we're doing. Really appreciate it. So thank you all for being here, and thank you to the press for covering this. I know you guys are swamped, and that will do it for today. Thanks, guys.
Yeah, thank you.
Thank you, everybody.
Thank you.